Dear all, radiating my warm greetings to all of you. I hope you are in pink of your health and spirits. So, dear friends, I am sure that you must have gone through the first and second video, and which was about what are the competencies to be acquired during doing the MD community medicine. You also must have reviewed that it is everywhere. Every system has a systems approach. There is an input, there is a process, and there is output. So input were the lovely students entering the MD community medicine course, ready to start the course, and there is some teaching learning happening, and end of that you successfully qualify MD community medicine course. Friends, in the systems approach, I mentioned about the output, that there is a successful completion of MD. During this process, students start thinking, oh, I have joined the course, and so what, like what I will be doing. Some of them must have made mind when they entered the course. Some of them have taken it by it wasn't not a choice for you, but now you should make this as a choice. So you start thinking like what will happen, what are the career options that I will have. So dear friends, it is all about this. When you are in the medical college, so most of the teaching takes place in the medical college, where you are involved with teaching, training, learning yourself, doing your own assignments. While doing this, you are participating in the UG teaching, in the research projects. Most of the time, these teachings are happening in the medical college. So basically, you are turned towards you're intended to join, oh, a teacher banna hai, like faculty banna hai. Lekin there are so many other prospects that students are now opting for. So we'll discuss about that. You acquire you are empowered to be a teacher because you see teachers around you. But while doing your RSTC posting and or other center postings, or going out with the students, visiting the clinical postings, so you're exposed to other places as well, where you become aware of what is happening there, but you don't acquire the full competency of other competencies. Basically, your postings will be divided into two, where you are posted inside the college, in the lab, or in the hospital. So these also, they help you in being a good teacher or a clinician. But what happens when you want to join other jobs? Like, so there are, in certain colleges, there are external posting, extramural posting, where you are posted at some NGO, or you are posted in the CDHO's office, in the corporation, and you are and other places. You visit factories with the student. So there you find some exposure, and you start making your mind that there are other competencies that you should acquire as well, garnish skills in those competencies. So I will talk of those as well, because I have seen during my life as a teacher, I have seen many students flourishing very well, even if when they were not teachers, or they have taken jobs as well. I also talked about 6 competencies. So if the input is acquiring skills in the 6 competencies, then the output will be that you will be practicing those competencies in some of the jobs, which where it will be a predominant role of one competency, but all these competencies are required everywhere. So dear friends, today the content overview of my today's video are, yeah. So Today we will talk about the various job or prospects or opportunities after completion of MD in community medicine. We will also talk about some tentative job responsibilities that you will play these roles when you're doing these you are doing jobs at various places. This list is not, it is not it is a not it is not limited to, but there are some important points that you will be there when you will be doing these jobs. So first one I talked about is that you are more inclined towards academia because you are in the medical college. So what will be the job responsibilities? Your job responsibilities will be like teaching undergraduates. So the small group discussions, clinical postings, going out with the students, teaching students in the field, teaching students in the classroom. These will be your roles, and completion of assignments as per the timetable of the department. You will also participate in teaching postgraduates. Now, if you are an postgraduate, there are chances that you also become a XR, the senior resident after doing your MD, and it's a very good thing to participate in the PG teaching, like in the seminars, helping them in their thesis work, helping them when they are posted at RSTC and other places. Then participation in resident and internship training program in the community setting. So interns are there they posted in our department. When they are there, so you help them you mentor them, you supervise them, you monitor their working in the fields and in the department. Assessment of UG students. You'll be involved in assessing, some internal examinations to start with. The nowadays it is CBME, so the formative assessments are more often the vivas, the spotting exam to start with. Mentoring and counseling and guiding undergraduates and colleagues. So mentorship is a very important role. I always call myself as a mentor, not a teacher we are facilitators. And nowadays, in the CBME, then there is now the electives. So electives, you can help them, mentor them during those small projects if students opt for in community medicine. The small student projects, ICMR projects, and other theses work. Managing the functions of urban health centers and rural health centers. You'll be involved in those community-based activities in the fields, doing field work, some surveys, involved in epidemic investigations. You are doing supportive supervision, monitoring of activities assigned by the higher authorities. So at RSTC UST, predominantly we are involved in, teaching our students and other health workers. Side by side, we are also providing them with technical and supportive role like monitoring the activities or in capacity building or any other requirement at the RSTC. Now, we are actually many projects come up to the department from the state, from the government. We have to evaluate those projects, and there are so many training that we ourselves need to take to become trainer of tutors, trainer of trainees. So capacity building, training health workers, staff nurses, medical officers in whatever the field is required for. Research project and scientific publication. This is also a requirement for promotion, but apart from your thesis, you can empower yourself in research by, taking up more projects and going for scientific publications to provide evidence for decision making. Participation in CMEs, conferences, workshops, and seminars. So we are lifelong learners. So we need to update ourselves by going out and learning from others through these activities. Curriculum planning and evaluation. So curriculum, I talked about the Kern curriculum. You must have gone through in the first video. And this is a pedagogic skill we will take later. Evaluation, yes. Perform any other duty as mentioned above, apart from that also assigned by the head of the institution of the department, maintaining integrity of the institute. Now, what does we mean by integrity? Very important quality of a good professional is integrity. And integrity means being honest and having good standard, strong moral values. So this will be required everywhere, any endeavor that we are involved with. So these were some of the ones that we need to be a teacher. You can add more to that. Another, job is you can take up is being a consultant in development sectors, like in the private ones and in the government ones, like you join WHO, UNICEF, UNFPA, CARE, micronutrient initiatives. You can join many other organizations like Public Health Foundation of India. You can join as consultants. One is, as even SHRC, State Health Resource Center. So what will be the, now here the predominant requirement will be that you have to be a good manager, execute good managerial skills. The competency will be required. Teaching training in all jobs that you will take for, but the predominant will be. So you will have to, it is a time-based, deliverables-based, time-bound jobs where you will have to manage your any assignments given, and then at the completion of the contract period, you will have to provide a report to the higher authorities. Visits, if it is a job related that you have to go out and collect some data, then you will have to do that, which you have already learned through doing your theses and small projects in the department. Training and capacity building of the field staff. So whatever staff in that sector is under you might be required to train them, the staff, health workers, medical officers. Documentation of activities. Now these consultant jobs are in of a contract period, so you are required to provide monthly reports of all the activities under you, and you have to, at the end also, you will have to provide end of assignment report to the higher. So documentation is another very important skills, comes under the managerial skills. Supportive supervision and monitoring activities. So a manager, supportive supervision and monitoring activities under the leadership. Somewhere I will take up later on what it is all about. So what it means. So you will be required always to to support in the working of others. If you find a gap in their performance, you try to fill up that gap, and it should be supported. Workshops, training of trainers. Yeah, you will have to conduct workshops if it is in the requirement of your of the assignment under your deliverables. You will have to attending conferences, holding conferences in the district assigned. This is in the public domain. It was 1310 only. This was that an advertisement in Divya Bhaskar, where senior consultant was required in Ahmedabad for the state health resource centers. Just an example. These such advertisements, you can join this job. Piloting and implementing of new the person has to be always creative and innovation. So while you are handling the projects, you can come up with best practices, operational research, pilot test them for scaling up in the program. Research and publications related to your activities or research that you are undergoing under the contract, you need to have research and publication. Keeping oneself and organization update on recent advances. We are lifelong learners. We have to keep up ourselves updated, and even keep that organization updated about it. And working in tandem and in cooperation with the government in the implementation of the government programs, then perform any other duty other than what listed under the head that you are working. Again, maintaining integrity of the institute. The third job that you can take is in the research organizations like Public Health Foundation of India, against state health system research centers and other places. Predominantly here you will play the competency which is there is biostatistics, epidemiology, research. Managerial and training will be always there in professionalism everywhere, but predominantly, it will be data analysis. So you should get well versed during your 3 years course with the various type of packages like SPSS and Stata and EPI-UFO, whatever your designation empowers you in that. Scientific writing, publications, and report writing, very important skill under this. Technical support in the research project management. So, if it is a multi-district project, or it is a, then you are expertise in research product. Developing high quality and compliant research proposals will be required, and monitoring and evaluation. So monitoring and the data as well, and the project itself, like data validation and verification of the quality of the data, and data triangulation. These are some of the things that you already learn when you're doing your thesis. Training is everywhere, training people under you for capacity building. Use of data findings are for effective. So why we produce data? It is the data should be effective in, in leading to effective and intelligent decision making. Liaising with other consultants and other relevant agencies under the organizations. Communication is a very important skill under this. So communicate everywhere. Good communication skills is very important. So you acquire these skills when you are at RSTC, USTC, and when you are everywhere. This and then perform any duty under the which is assigned to you under the head of the department, and maintaining the integrity. So professionalism is a very important competency, very less taught, very less observed. So this should be formally taught in the curriculum. Maybe in professionalism we can have 10 to 15 videos uploaded on this aspect. Another thing is you can take up clinical research organization job in the clinical research organizations like say Fortis Clinical Research. So you can, here the predominant role here also will be being that of a manager, being that of a good researcher, epidemiology and biostatistics. So if you're in the clinical research, mostly there are clinical trials going on. So you will be responsible for the management of the clinical trial, like recruiting or selecting the investigators, recruiting appropriate patients, maintaining the data file like protocols and case report forms and consent forms and agreement letters and CV of all investigators, the brochures that will be required, the ethical, the confidential part of it, and you have to put those deal with the ethical research committees and comply with the research committees advisors. Now in the clinic, when you are in the clinical trial, mostly if they are going on at certain places, though, you have to arrange for site initiation meetings with the investigators, coordinating the movement if the samples are required and the samples have been to be moved from the central research laboratory to other laboratory, then there should be the data becomes important and the confidentially part of it. Ensuring procedures they are in place for patient equipment. If anything required, like by the investigators, what are the inclusion criteria, exclusion criteria. So all those, ensuring those procedures. And then working according to the standard operative procedures in the protocol in the research clinical trial, which is according to the good clinical practice. Fulfilling requirements for the clinical trial material. Sometimes, there is a trial for drug trial. So the drug is available in time, placing order for the drugs, monitoring the movement of the drug, storage of the drug at the site where it is to be given. So all that should have to be monitored very meticulously. Maintaining project files, I've already talked about it. Project files might also include what communications have been done by the with the other investigators, all their salaries, and then all those things also it should be there. Then perform any other duty assigned by the head of the institute and maintaining the integrity of the department. Another one is that the opportunity you get is that you can join medical services as CDHO, Chief District Health Officer, RCHO, Reproductive and Child Health, ADHO, block health officer also you can if you're interested. So here the predominant competency is managerial, managing all matters related to human resource, financial resource in the respective district, providing logistic support to the staff, providing managerial support at all levels. So you have to be a good manager and administrator, supporting from the grassroots level, ASHA worker till the district level, anywhere where managerial support is required, we need to provide that support. And providing feedback on improvement side by side, monitoring the program indicators. So these program indicators gives us about the trends, like what is the decreasing trend, of which aspect is rising trend, and these are very good for decision. This will be used for sound decision making. Analyzing, there will be certain reports. So analyzing financial and physical progress report to take corrective actions for improvement of the output. Coordinating and liaising with the representative partner organizations like Women and Child Development, RCHO, and other, the Food and Drug Department, and other consultants, whatever is the requirement, who all are the stakeholders, need to liaise them with good communication skills. Then managing epidemics, investigating adverse effect following immunization, any other health related issue like child health reviews, maternal death reviews, to name a few, maintaining integrity and performing any other duty assigned by the head of the institute. Now, one becomes a CDHO after doing 5 years job as a CHCMO or PHCMO. That is the requirement in most of the places. So to start with, if you're interested in medical services, you can always join as MO at the CHC. So apart from a MBBS MO, you are much more equipped and empowered. You have higher skills in managing the places where you work from. This competencies already you have gone through in undergraduate, but you can do more efficiently. And I've seen many of my MD students under me who have joined the urban health centers, who have joined the CHCs after doing community medicine. You can play better managerial role and all other competencies. So what a MO does, OPDR. So, what are the main roles of an Indian medical graduate? It's a clinician, professional, communicator, leader of a healthcare team, and a lifelong learner. So, all those skills. Sometimes, people ask, oh, community medicine is not a clinical branch, but according to me and my experience says that it is very much a clinical branch, because so many things that you are doing at the RSTC and UHTC is a clinical. This all you're handling all health programs, providing, even you can head some NCD clinics. Isn't that clinical? So OPD handling is a important skill, and supervising the work, planning, implement all health programs, visiting schools, arranging medical checkups, training of health workers, visiting sub centers regularly on fixed days for providing monitoring support, supervision, and leadership. Spending a day each month organizing meetings to review the progress and make improvements if required. Maintaining the integrity of the government here also, and performing any other duty given by your managing epidemics, investigations. Now this role, people think, I'm passionate about, occupational health, and I believe that, occupational medicine is generally a preventive medicine. You can be a industrial health officer or occupational health and safety officer. Recently, one of my SR has joined the Reliance industry, so it's a very good opportunity. During my tenure, I have seen many, my colleagues and my students who have joined the industries. What will be required is that you empower yourself through certificate courses or small or courses in industrial health, and you are very efficient. You can be very efficiently working there, and it is a very satisfying job for many of my colleagues I have seen. So what will be your job? Promoting highest level of occupational health and safety within the organization, and ensuring that the working environment is healthy and safe. Inspecting workplaces and equipments, whether they are hazardous or having risky operations. So their inspection. There is a factory inspector. Factory inspector post is one of the medical post. Industrial factory officer, health officer. Identify and test workplaces for potential hazard. Develop occupational health and safety systems, including the policies, guidelines, standards. Work with the engineers for environmental control measures. Ensure that personal protective measures like masks, shields, eye shields, goggles, whatever is the requirement, are there in the place. People are trained how to use them according to the regulations, and they use it consistently. That should be ensured. Ensure that dangerous materials are correctly stored and not piled up. Ensure that the organization is aware. So sometimes organization is not aware what is the plant design, what are the type of equipments, what are the type of work required, what is the working environment, what are the duty hours. So they need to be made aware of all legislations in factory laws and acts. Record and report hazards, accident, injuries, and health issues. Assist in investigation of accidents. There are notifiable diseases. If such things have happened, hazardous conditions and accidents, injuries, and diseases are notifiable. They should be notified. And rehabilitation of workers, whether they are getting compensation, it is our job. That conducting training sessions for the managers, for the supervisors, for the workers, coordinating emergency procedures like explosive fumes. So that has to be seen. Now should not happen. Communication about all aspect to the management, maintaining integrity and performing any other duty as which is not included above and assigned to you. Another very important right prospect is, people can think of having their own preventive health clinic. Why not? Independent preventive health clinic, because now, prevention is the mainstay, of healthy country. So if prevention is better than cure, and we have lot of scope as the NCDs are increasing, the nutrition and nutritional problems, and why not we can open that. So preventive health clinic, early diagnosis, some treatment, and where to refer. So we can have referral linkages. Also, you may be appointed as an administrator, might take up that job in private setup. So this is the recap. I was talking about the curriculum. We'll take this later on. So these job prospects that I have, described above, they are in line with the 6 competencies stated earlier in my first video. Let us come back to the systems approach I was talking about. So all that is required is a change in behavior, which does not happen one observing things once or twice. It has to be repeatedly practiced to have a permanent change in behavior. Ruskin rightly said that education is not teaching what they do not know. It is not about teaching learners what they do not know, but making them behave as they do not behave. So I again summarize. So these were the inputs, the 6 interestable professional activities, competency, then teaching, learning happened, and those job prospects that I have described, you are now playing that role. So, dear students, what next? Every time I leave one topic, I might take up. Now, let me start with introduction to community preventive and social medicine, very basic, and then we take some PG level lectures. So, I might come up with this, or start with what. Let us know what is our health policy, and then move forward. So, dear friends, have a day as lovely as you are. Keep safe. Thank you.